Welcome to Counterpoint. I'm Tanya Granick-Allen. Perhaps one of the positive takeaways from the COVID crisis is that mental health is being talked about more and more, and for good reason. So many Canadians have been living with increased anxiety, increased isolation, and general poor mental health since COVID entered our world. With more Canadians struggling to cope, more conversations are being had. 1 in 3 Canadians will struggle with mental health in their lifetime, and in any given year, 1 in 5 Canadians will personally experience a mental health problem or illness. In 2019, for example, over 4,000 Canadians died by suicide, and we know that number is only increasing with COVID. So what does the mental health of Canada look like as we wrap up year 2 of COVID? What is being done to cope with the rising caseload? And how are Canadians being helped? And what are some of the practical tips to help improve your mental health? Well, joining me for a panel discussion on this topic is Rebecca Shields, CEO of the Canadian Mental Health Association for York and South Simcoe, and Dr. Tim Law, associate professor at the University of Ottawa Department of Psychiatry and clinical lead in the geriatric inpatient unit at the Royal Ottawa. Thank you both so very much for joining me today for this very important discussion.
Thanks for having us.
Excellent. So I guess we'll start with an overarching question, to take the temperature of what's happening. How are Canadians faring with their mental health? Maybe I'll start with you, Rebecca.
That's really is an interesting picture. What we're seeing is, about a year ago, about 66% of Canadians said that they weren't in very good mental health, which was an increase from 47% pre-pandemic. And now the latest data that we've had is almost 80% of Canadians feel that their mental health is worse off than it was pre-pandemic. So people throughout these past 2 years have really been struggling. Now we're seeing some positive indications, but on the whole, the pandemic, and then you have, people feeling hopeful, and then they hear things like Omicron, and then they get concerned again. And so this, will we ever get out of it, is concerning, but certainly there is some progress and that people are feeling more hopeful.
Dr. Lau, what are you seeing with your practice and in your work?
Yeah, well, I agree with Ms. Shields. There has been, the survey data shows from 2020 that people are experiencing more stress and anxiety, for sure. That's clear. It didn't necessarily translate into increased suicides in across the world in studies in the last 2 years. That is the surprising thing. I think there have been some discussion about our psychological immunity, as it were, to face these kinds of stresses. I think people, for sure, when asked with these subjective surveys, are under a lot more stress. Mm-hmm. And the uncertainty from the beginning was the biggest part of it. We didn't know when it was going to end. We didn't know what we were facing. I think now with each of these things, when we have rising case numbers, at least before, when we didn't know, it was a lot harder. At least we sort of have a sense of what to expect. So there is less of an impact, but it's moving into a kind of like a chronic phase now. We're sort of chronically feel uneasy, and that is the problem with as one of my friends said, this is not how they wanted to learn the Greek alphabet.
My goodness, interesting and well said. But what you said was before that, it was interesting that this is almost like the new normal. This is, they're chronically feeling uneasy. It's a chronic situation. And I think the 80% number is quite shocking to me, because I figured most people would see now, okay, we're probably not getting out of this anytime soon. So this is, as they say, the new normal, and we kind of have to adapt. It's still stressful. We still have anxiety, but this is kind of what we're going to be facing for the while. Are people becoming more resilient, Rebecca?
I think people are amazingly resilient. However, I think that we have to understand that stress can be like a little takes its toll over time. And so we all have been learning throughout the pandemic about how to do some positive coping mechanisms. But one of the challenges is that another thing might cause more of an exaggerated reaction than we had in the past. we saw an increase in binge drinking. We saw an increase in substance use, in all of those things. And then those things sort of take a toll over time.
Okay, and Rebecca, I've got to pause you there. We've got to cut to commercial, but I'll come right back in a moment. Welcome back to Counterpoint. We're having a discussion on the state of mental health amongst Canadians and mental health care in general. And joining me is Rebecca Shields and Dr. Tim Lau. Rebecca, before we went to commercial, we were discussing, I guess, the capacity of resiliency with Canadians, those who are struggling with their mental health throughout, I can't believe we're saying this, but the 2 years since COVID. Please carry on with your thought there.
I was sharing that people have been having more stress, but one of the other impacts is that people also haven't necessarily been seeking care for any of their health issues. Maybe they haven't seen their primary care doctor, or they just feel like they may not want to attend the hospital. And so what we're seeing both in community mental health, and I'm sure Dr. Lau at the hospital, is that people are coming in after waiting far too long to seek care. And there's people, have much more serious problems. And so one of the things that we're really trying to tell people is, get out there if you have concerns and see your doctor early. Dr. Lau.
Yeah, no, for sure. There is an issue of access that is, the cancer screenings, for instance, that has been a huge issue that people have identified, because people are in the first year, especially, people stopped going to their doctors and they were afraid. So that had a huge impact on access. And in the area of mental health, it in some ways has been a mixed bag, because I've had patients who've come to the hospital that because of anxiety, they would not be able to. So the technology for those that have access to it helped. But for most people, they don't have, a lot of our patients don't have the means to have to use technology to come in. So access has by and large been worse, but there have been some innovations as a result of technology. So those are serious things that have happened with the pandemic. People, and I know people are under a lot of stress, including the healthcare providers.
Yes.
And it comes out in different ways. And I think the thing that you were talking about, having it out in the open and the importance of it, because if you can't put a name to the stress, it takes a life of its own.
If I can add, it's really important to also understand that those with the more serious issues are faring worse. We've seen a huge rise and lack of access for young women or young people with eating disorders,
right,
which has been identified by the province as a huge issue. People are now who need both medical and mental health care are having to wait or can't even get into inpatient services. For people with substance use issues, we've had a radical increase in opioid deaths. And we recently saw in the newspaper Indigenous communities that have had a staggering amount. And so again, those who are more acute have really fared worse because of some of these access issues. But I agree, for those of us, particularly when we get into areas where people can seek support, the way that we can help people through virtual care and the fact that we're reopening up has been huge in terms of, people that are managing or people who see that their family members are struggling can get much better access right from the ease of their home. And so that's a real positive thing that's come out.
Now, I know, Rebecca, when we chatted, I guess it was about a year ago, just a few months after we started COVID, maybe it was September, we saw some of these statistics about the eating disorders, about, the rise in youth suicide and the rise in mental health diagnoses. And I know the mental health practitioners and the care community really had to pivot quickly. It was very hard during that first lockdown, but by the second and maybe third lockdown, we improved. So I guess I'm going to ask a question. Nearly 2 years later, is care providing better or worse than when we were at the onset of this crisis?
My comment is, and I'm sure Dr. Lau will have something different, is that there's a range of care that people need. And when you talk about really serious people who are highly symptomatic in an acute phase, like an eating disorder, they both need hospital care because, of course, they're medically fragile. And then they need ongoing support. And so a virtual session isn't going to cut it.
Right.
People with significant substance abuse issues, where they can have an overdose, virtual care isn't going to cut it, even though there's been some incredible innovations like safe lines where they can use with somebody on the other end of the phone. But you're talking about people with real challenges that have been isolated. When we look at, other sort of key, I think, acute illnesses like schizophrenia or psychosis disorder, a lot of those folks need inpatient or they need face-to-face care. So we're doing that work, and we're adding virtual care. So I think we've had great innovations and great expansions, particularly in the areas of anxiety and depression.
Welcome back. We're continuing our discussion on the state of mental health amongst Canadians. And joining me again is Rebecca Shields and Dr. Tim Lau. Dr. Tim, before we went to commercial break, we were exploring the discussion of those with pre-existing acute mental health concerns and how their care may have improved or diminished during at least the first wave or the first lockdown during COVID, and now where things stands. What are you seeing in your care practice?
Well, what we do know is that certain conditions like eating disorders, the data from the UK, their number of referrals doubled in 2020. So we know that the wait times and the referrals have gone up, and as Rebecca has said, the addictions also has spiked upwards. And one of the interesting findings of this pandemic from a mental health point of view is that it affected different age groups differently. People who were younger were much more severely affected.
Right.
Those from the age of 18 to 30 were the group that had the most of a negative impact. So I think rates of hospitalizations didn't necessarily go up during the pandemic, and there are many reasons for that. People generally they don't go and seek help, and that is. And the same that was a bit of a surprise with the suicide rates, that they did not go up during the pandemic across the world.
Mm-hmm.
But for sure, the group that had the highest psychopathology were the younger people. That was.
How is that being addressed? I know just from personal experience, and maybe because I field a lot of emails and calls from friends and supporters and viewers, and I know that the mental health of a lot of these students in university settings where there were these vaccine mandates, then they're still being implemented and pushed through for those students who didn't want to, for whatever reason, get vaccinated. I mean, the thought of them having to give up their school year after doing all of that last year, surviving last year, their mental health plummeted. I spoke to even one young student who was on the brink of suicide, and thankfully she's alive, she didn't take her life, but she really felt pushed to the brink. And sometimes I wonder on how much more can the younger generation handle? Are we putting too much on them? And are we, in one hand, helping them care, on the other hand, putting up obstacles? And maybe this is not even a conversation for you, but I wonder about these things.
It's an excellent point. And, with our changing information, the changing news cycle, global events, there seems to be a real pressure cooker with young people. And so the question is how do we appropriately support that age group, particularly because we know in that, 18 to 24, there's still huge brain development in that time. And so with youth, we really want to be mindful that we're helping them develop positive coping mechanisms. And, how did we do that? And there were many students, again, that were at risk, that got lost from the school system, that weren't engaged in online learning. And so bringing those people back in. So I think what I can tell you from a community perspective, there's a lot more outreach going on. We're working really hard with all of our social service partners to connect to those youth in positive ways. I know teachers are doubling down on, meeting kids where they're at, and school counselors. So the school community is working hard. other community organizations like our Wives and our Boys and Girls Clubs and all of that. So it takes a village approach.
Yes.
And we need to work in an integrated manner. And we need to be working, with our primary care to ensure that those who are at high risk are getting the medical support that they need. But it really is about offering them a safe and welcoming environment wherever they're at,
right,
so that we can bring them back into a good place rather than feeling isolated, dejected, a lack of hope, overwhelmed, all those feelings that, can bring somebody, but not necessarily at a risk to suicide or maladaptive behaviors like, exploring with drugs or alcohol or gambling or any of those things that we don't want them to do. We want them engaged in school and their community and sports and their families, those things that are protective.
Now, Dr. Law, we only have about 30 seconds to commercial. But with these new obstacles, it seems every week we have a new restriction or a new scare, like with Omicron, for example, and all these new letters of the Greek alphabet. And you know what, maybe I'll actually ask you this, I'll let you answer this question when we return from commercial break because we're getting close. But how can we expect the mental health of even the young generation or of any of us to get better if things are just changing all the time? We feel like we have no control over our circumstances or our surroundings. I want to answer that in just a few moments. How's your mental health? Are you worried about what the future holds, especially in the time of COVID? Well, joining me is Rebecca Shields and Dr. Tim Law, who are helping us unpack what the state of mental health is for Canadians across the country. Dr. Law, before the commercial break, I said it very plainly. I don't know how, the young generation can feel confident, or I'm not surprised they have such deteriorating mental health when every day brings a new restriction or they have to pivot suddenly or their schooling changes. How can we expect them to be resilient to that degree when there's no constant?
Yeah, that's an excellent question. And I think the data was showing us even before the pandemic that mental health for youth and for young adults were already skyrocketing. Prior to 2012, if you look in the last 60 years, rates of adolescent suicide went up 600%. So it was already considered to be an epidemic in 2012 by the World Health Organization. Depression was. So the pandemic has magnified things and made things much worse.
Mm-hmm.
I think the question of what to do about it starts with first recognizing the problem. Like if you can't identify the problem, it's hard to look at solutions. So one of the things that, we realize that for people at different stages of life, their focus is different. And part of the challenge, I think, of the pandemic, if you look at research that has been done in this last year, people in younger age groups, their focus is on discovery in their teens, and then pursuit in their 20s, and balance in their 30s, and meaning in their 40s, because that's what people often are focusing on in terms of well-being. So. Right. I think for the people who were trying to discover in their late teens or trying to find pursuit of their goals when everything is stopped is really hard. So recognize that there's a huge issue for them, that we don't actually even know what the long-term effects are going to be. These studies have not been done yet. We do know that they are under much more stress than other age groups. And you see it in eating disorders, you see it in substance abuse, you see it in depression and anxiety. So all of that is likely to, sadly, become more obvious over time. And as you said, we keep seeing new things and new challenges. It's almost like you're looking from moment to moment for the new stresses, what the new challenge or threat to your life is. And that's hard. I think that's really hard.
Well, I know even for me, I feel like that I'm almost on pins and needles, wondering, and I'm almost scared to check out the news because there's going to be some new indication of what might be announced tomorrow, and it's almost this anxiety of anticipation. And again, this is just me. There are millions of Canadians with very serious mental health conditions, and I can only imagine how this life of moment to moment can be really unsettling. We only have about a minute left, and I always like to end off my programs, especially dealing with health and wellness, on some tips or what advice you would give to someone who is struggling. So maybe, Rebecca, I'll let you tackle this.
Sure.
If there's a young person or an adult who's struggling with their mental health and it doesn't seem to be getting better, what could they do? What's out there for them?
First of all, you need to know that lots of good investments have been made, and we have opened up access. So there's a great program in Ontario called Bounce Back, which is free cognitive behavior therapy, which is all about building those skills to manage worry and anxiety. Just Google Bounce Back. There also, you can go to your primary care or your school counselor, anybody. There's a lot of resources out there. The holidays are coming up. And so let's just take a moment and think about, how do we manage the holidays? Let's think about balancing our holidays, about expectations. Let's think about making sure that we help others, because when we help others, we help ourselves. And the other thing too is also plan moderation. I always tell people, say, if you're one of those people that wake up all the time feeling a bit of guilt and shame over overindulging in anything, just think that through, right? You know, if you like to drink, and I do over the holidays, get a large glass, make sure there's lots of ice and water in it. You know, have a glass of water in between each cookie, fill up your plate with salad. You know, there's lots of things that we can do. Just plan ahead a little. What did they say? An ounce of prevention is worth a pound of cure.
Excellent.
Yeah.
And on that note, we'll leave it there. Unfortunately, we've run out of time. But thank you both so very much for joining us. And we'll have to touch base again in the near future.
Absolutely. Take care.
Thank you. Many of us are struggling, and those with pre-existing acute conditions are probably struggling the most. But know that there is help out there. You have to ask and you have to knock hard, but it is there. For Counterpoint, I'm Tanya Granick-Allen.